Hello everyone, I am Dr. Vipul Chakurkar, nephrologist at KM Hospital. Today I am going to talk about hypertension in adolescents and young adults. The purpose of this talk is to make aware that hypertension is not uncommon at that age. So usually hypertension or high blood pressure is considered as disease of more than 40 years or maybe somewhere around 60 years. But it is not uncommon, and it is about good percentage of individuals below 40 years can also get hypertension. Usually it is manifestation of some other disease, and most of the times it is kidney which is at fault for producing either high blood pressure increasing substances, or the kidneys are not functioning properly. That's why the BP is elevated. Unfortunately, the finding of high BP at an early age is often ignored by patient or the relatives. Many times medicines are started, but patient take it for about 10-15 days, and then the medicines are stopped either by patient or is told by the relative. That leads to ignorance, and that leads to increased BP, which can damage the major organs, or the patients can represent with very severe complications of blood pressure. Often it is thought to be due to anxiety, work related stress, tea, coffee or smoking, or it may be related to physical stress that the patient may have. So high BP at that early age needs to be monitored. It needs to be managed and investigated properly. Mainly we need investigations for the kidney function, urine for protein, urine for blood, and sonography of abdomen, and blood electrolytes, along with thyroid function test, and if required some other hormone tests. Once the BP readings are confirmed, we need to treat it with BP lowering medications, and patient need to take these medications for a long time and on daily basis. It should not be made on as required basis, because that leads to increase the uncontrolled blood pressure. Once the BP is controlled, we can investigate patient for the kidney disease, and if the kidney disease is found, he should be in follow-up with a nephrologist. By controlling blood pressure, we can avoid devastating complications such as brain stroke, heart attack, or permanent kidney failure. If the kidney disease is detected early, it can be treated, and one can prevent permanent kidney failure, or at least can postpone it. So to conclude, one should be aware that hypertension can be detected at an early age, even 20s, 30s, or even adolescent age, and it needs a proper line of investigation as well as treatment to avoid further long-term complications. Thank you.